Good morning. I'm Olivia Casey, Senior Director of Programming at the Autoimmune Association, and I'd like to introduce you to my friend Dr. Julius Birnbaum, who's the author of the book Living Well with Autoimmune Diseases, a Rheumatologist's Guide to Taking Charge of Your Health. Dr. Birnbaum is the only physician in the U.S. who has completed training in neurology, internal medicine, and rheumatology. Now, this rare combination gives him an unmatched perspective in the complex ways autoimmune diseases affect the body. His background in neurology helps him understand how conditions like Sjogren's and lupus attack the nervous system, which causes pain, numbness, and cognitive dysfunction that some doctors may overlook. His expertise in rheumatology allows him to see how the immune system mistakenly turns against the body, damaging joints, tissues, and organs. And his deep knowledge of internal medicine, he can connect the dots between autoimmune diseases and its impact on multiple systems, whether it's inflammation of the heart, lung complications, or kidney involvement. I say that Dr. Birnbaum is my friend because reading his book is like having a conversation with someone you know. The way he explains autoimmune disease with such compassion and intelligence, and I really do feel supported by his work, and much, much more knowledgeable. Welcome, Dr. Birnbaum. Now, today we're going to dive right into an important theme that runs throughout your book, and that is a personal empowerment. Why is it so important that patients be empowered and take an active role in their care?
Yeah, I think that's a great first question. So I think it's really important to try to individualize your care, especially when you go to see a physician. Now, in a new patient appointment, perhaps to give it around 30 minutes appointment. And in that appointment, you'll come in with certain symptoms. Your physician will elicit certain findings on physical examination, and you'll go right to a treatment plan. And often a treatment plan doesn't include what your thoughts are, what your convictions are. So I think right at the outset, it's important to understand that you are different from any other patient, and you have the opportunity with empowerment to really communicate with your physician what you want out of the visit, and more broadly, how you want to live your life enjoyably despite having an autoimmune disease.
That's terrific advice. So, what are some tips that you would recommend for those who were newly or recently diagnosed to feel more empowered in their healthcare journey?
So, first is hope. I say that again, and I just want to really emphasize that the care that we can provide to patients right now is so much different than 10 or 20 years ago. So, in many ways, we really are in a golden era of rheumatology and autoimmune diseases. In terms of follow up visits, I think that knowledge is power. And I think that there are a lot of resources are available by books, by social media, disease foundations that can help you understand the disease in ways that weren't possible 10, 20 years ago. I think empowerment through knowledge can come through books. I'm hoping that my book can help patients so it could be a valuable resource that they can bring to physician appointments.
But how does knowing about rheumatic diseases help patients build a sense of confidence in the exam room? I mean, we're not doctors, but how does understanding the disease help you in the exchange with your physician?
So I think there's a certain complexity to autoimmune rheumatic diseases that's different. So, for example, in the advice I give in the beginning of the book, if you have a sore throat, your doctor could swab your throat and there's a diagnosis. If you have high blood pressure, that could be easily detected. When it comes to autoimmune diseases, a lot of the symptoms can seem very disconnected. There can lack a certain epicenter. And I think what happens if you understand the variety of ways that autoimmune diseases present, it can really empower you. So lupus, for example, there's so many different ways it can present. It can present with rash, oral ulcers, pain when you take a big breath. So when you look at a certain list of symptoms, you could say, aha, that's my symptom. And then once you recognize your symptom is present, then you could start connecting the dots even more. And once you have a certain sense of where the autoimmune disease goes, the momentum, and how you play across in this autoimmune diseases, then I think you could acknowledge and understand the disease process a little bit better. It's inherently more complex than a lot of other diseases, but I do think that once you have a broader perspective about the disease, then that actual broad perspective will allow you to have a more individualized account of what your disease process is.
Well, something that's come up, I mean, I think we've all experienced this, but a lot of patients feel intimidated during medical visits, particularly when you don't feel well and you're there and you don't really understand what's going on. So, how can patients prepare themselves to be more active participants in those conversations? Because you want to establish a dialogue with your physician. So, how can patients be proactive about that?
Sure. So this sounds like a little bit crazy advice, but I don't think it is. Allow yourself to be intimidated and show your physician when you walk into a physician's office that you might feel intimidated, and that will elicit a certain sense of compassion. I have certain patients who come in with their rheumatic diseases, and they don't complain, and they tend to be very stoic. And I'm like, "How are you doing?" "Great." "What's new since last evaluation?" "I'm doing great." And then I see that their joints, for example, are swollen, and their partner is there in the room, and they're like, "How can you say you're feeling great? You've been suffering day and night. You can't sleep at night." So it sounds like crazy advice, but I think the important first step is to allow yourself to open yourself up and feel intimidated. So it's a little bit of a crazy advice, but I think that's important. And I do think that preparation before an appointment is important, because I think that when you go in, if you don't prepare, the visit can kind of swallow you, and you're not going to be able to really talk about what your hopes and dreams are. So I think that you understand that even though you have an autoimmune disease, that doesn't mean that autoimmune disease can rob you of your sense of individuality. So you can feel intimidated, but to whatever steps you could start reclaiming your personhood as an individual and a true life person, writing down what you want, writing down your passions and convictions, journeying about your passions and convictions. And I think taking journals is really important. So anything that you can do to recognize that you are an individual and not just a patient, and be that open up to your physicians, make yourself feel accessible, prepare for the visit, journal, think about what matters to you most. I think that these are all ways that you can find your sense of individuality and then feel less intimidated during the visit.
We're going to get on something that I think is that this takes us to, which is shared decision making. And why is it so essential for patients, specifically with autoimmune diseases?
It really is important, because the expectations of how you want a disease process to be treated needs to come from a collaborative way. And there are opportunities for collaboration, both having informal dialogues as well as collaboratively measuring how aggressive your disease are. And that's certain disease metrics or questionnaires that could be mentioned during the visit. So I think that that's an important aspect to the disease. The other thing about shared decision making is that we're way, thankfully, away from the era 10, 20 years ago, even longer, where there was a paternalism, and it was implicit that the physician knew what was best for you and therefore made decisions. But right now, when I have a patient, and I think that there's a lot of ways we can go, there's different medication strategies that we could think about. We could weigh risk benefits. And these are really all things that require the input of you as a patient. So that's what shared decision making is. It's having collaborative discussion with your physician to help provide your thoughts about the diseases at the forefront of the visit.
This takes me into a question, which is what tools or frameworks do you recommend to help patients evaluate treatment options collaboratively, especially when the path is not clear cut?
Yeah, so I think it's really important to go into that visit and just have a frank question with your physician saying, "Look, I'm a I'm an individual, and what ways can we go about assessing what matters to me autonomously? So I encounter this a lot in my practice. So to be honest, there are situations in which I don't agree with the patient's desires. So, for example, I might be on the cusp of providing a immunosuppressive medication, and usually before prescribing immunosuppressive medications, we recommend that patient get vaccinations. And the reasons are if your COVID vaccination, shingles vaccination, if you don't get these vaccinations, then if you develop these infections when you're on autoimmune disease, immunosuppressive medications, those infections can be really, really severe and painful. And most of my patients want to get these vaccinations, but I do have a few patients who are dead set and they don't want to get these vaccinations. And that's where there's a shared decision making. And I could try to explain the rationale for getting the vaccinations. I could try to explain the implications of how sick you could get if you don't get these vaccinations. But at the end of the day, if the patient doesn't want to get the vaccinations and doesn't want to, and as long as they acknowledge the risk, that's shared decision making, and I'm going to respect what the patient says. So shared decision making is just a wonderful opportunity to build a collaborative bond between you and your patient, and your desires will really come at the forefront, and it provides a way for physicians to honor their commitment to you.
One final question. For someone who's feeling exhausted, not just physically, but emotionally, what's one small step that they can take to start feeling empowered again?
Well, I think a great step to feeling empowered again is trying to get more information and building rapport. And you could do at the same time get more information and building rapport by attending patient conferences. And these are amazing conferences. They have lectures by physicians and laypersons talking about the challenges of autoimmune diseases and different treatments that might be on the cusp of the horizon. So I know that the Autoimmune Association is having a upcoming patient conference in the fall, and I think that's a wonderful opportunity for patients to go and learn about their disease and supported by laypersons.
Well, thank you. Thank you so much, Dr. Birnbaum. This was a terrific interview. And by the way, we do want to give you kudos for that terrific book. I think you have if you have a copy there,
No,
Living Well with Autoimmune Diseases. I truly suggest as a patient that you take a look at this. It is really like having a friend with you in the office. Thank you so
thank
much,
you.
Dr. Birnbaum.
All right, it's a pleasure. Thank you.